My name's Lucy, and Dr. Nassif saved my life.
Dr. Nassif saved her life with a nose job?
I was in a motorcycle accident in Italy 15 years ago and hit a cobblestone wall.
Just because of all the trauma you've had, we want to get a CT scan.
So she was on a motorcycle and hit a concrete wall, smashing her nose, and it looks like she's had a ton of reconstructive surgery to it. Whenever you get a new patient that's come in and has had a bunch of surgery, one of the most difficult things is trying to figure out what they've had done and trying to make sure that any surgery that you do afterwards doesn't cause them a problem that could have been prevented had you known what they did before.
In your CT scan, there showed an aneurysm. I'm going to connect you up with someone that's one of the best in this field.
What about my nose?
We're not going to even address that now.
Oh wow, so they did a CT scan to look at her nose and found an aneurysm in her brain. Aneurysms are basically abnormal outpouchings of blood vessels, and the worry with an aneurysm is that aneurysms can literally pop. Now, sometimes you have aneurysms that are really small in small vessels, like the ones around the brain. Some of the biggest ones are aortic aneurysms. The aorta is the largest artery in the entire body, and you can actually get a large aneurysm in the aorta where you get this huge outpouching of that vessel. Some of the worst things I've ever seen throughout my surgical training is an aortic aneurysm that actually pops, it tears, and people can die within minutes of something like this happening. So I'm so happy for her that she was able to get attention for something that is so dangerous for her.
One of the worst days of my life was when Dr. Nassif called me and said that he cannot fix my nose. You know, I thought my nose was the worst thing, but as far as I know, a nose hasn't killed anybody before.
I have so many patients who come to see me in consultation and they want a cosmetic procedure, like a facelift or eyelids or breast reduction. And I look through their medical history, and their medical history prohibits them essentially from having the operation done. Maybe they've had a recent heart attack, or they are on a blood thinner because they've got stents in their heart. Or maybe they just have multiple medical issues that just put them at high risk of having complications. I turn down 1 out of every 5 or 6 people who come to see me in consultation, and sometimes it's not because they can't physically look better if we do the operation, but it's because I am worried that if I bring them to surgery, that they're going to actually die. And the hard thing sometimes is to tell them that I can't do your cosmetic procedure because I don't want you to die from the operation. There are people who will tell me, Dr. Yoon, I'm willing to take that risk. Well, I'm not.
She was involved in a motorcycle accident in Italy.
Yes.
From that CAT scan, we saved her life.
Every once in a while,
We save a life.
you get to save a life.
One of the best feelings as a plastic surgeon is when you perform an operation and you improve a person's quality of life, and they are so happy from having it done. But even better is those really rare cases where you do actually help save a life. Sometimes this can happen in situations that are so simple as, let's say you perform a breast reduction on somebody, and every time we remove breast tissue, we always have a pathologist look at it. And I have had, of the thousands of breast reductions I performed, a couple of instances where we find breast cancer in the tissue that we remove. And finding that breast cancer early from this operation has actually saved some of these patients' lives. There are other times where we do preoperative testing on patients prior to a cosmetic surgery. We find something abnormal and we head off what could be a potentially disastrous situation had it never been found in the first place.
Well, you really are collapsed here. You have no airway at all.
Do you think that's a scar right there?
I don't think so. She already had an incision here.
This is a really tough situation for her nose. It looks as if she had some reconstruction of the bridge or the dorsum of her nose, and there's a scar right underneath that area, and her nostrils have obviously been a bit collapsed. If you don't have the records of what the previous surgeon has done, this really is a very, very risky situation because it all comes down to blood supply. If you operate on this nose, are there parts of the nose, just by literally cutting it open, that could potentially not survive? That could be an absolute disaster.
A lot of what we do depends upon blood supply.
So a scar blocks that off, or?
Previous dissection disrupts blood supply.
I talk about blood supply with so many of my patients, especially when you're doing revision surgery. Now, I stopped doing rhinoplasty surgery a few years ago, but in my situation, I do a lot of revision surgery on breasts. And when breasts have been taken apart and put back together by other surgeons, sometimes a couple of times, the blood supply can be altered so that if you make the wrong cuts on a breast, you could cause the nipple or the areola or both to lose blood supply and to actually die. When your tissues don't have sufficient blood supply to survive, usually they'll start by turning a bit purple, then they'll turn black, and then they will look essentially like char, which is what we call necrosis. Then that char, or the rest of that leftover tissue, eventually falls off. It is not a good sight.
You have a good chance of 50% improvement and a good chance it could look worse.
Really?
Yeah. You could lose the entire tip skin.
When there's not sufficient blood supply to the nose, the area of the nose that usually is at highest risk is the tip of the nose, and that's what you worry about the most. Although overall the nose has good blood supply, when you've had so many operations it appears she's had done, this really, it's just a minefield of potential complications.
The plan for Lucy's surgery is to first open the scar in the middle of her brow and drill down to give her a better contour.
Okay, so that is pretty unusual. So she must have a scar up at the base of her nose here, what we call the root of the nose. And by incising into that, because that part of the nose sticks out too far, yes, you can take a drill or a burr and you can basically shave that down if that's bone. I assume she has bone in a graft over that area, and so what he's doing is reshaping that bone.
Next, I'll go through her mouth and add a piece of rib tissue to provide better support to the nose.
So why is he going to her ribs? Well, we can take cartilage and bone safely from the ribs and use that to reconstruct body parts, specifically the nose. Now, one reason why the rib works pretty well is because you can carve a rib to be fairly flat, and you can carve it to be in kind of a rectangular shape, which really does fit the shape of the nose pretty well. Now, why he's going through the inside of the mouth and not through the base of the nose, I'm not quite sure. It could be due to where her current scars are, or maybe some other type of surgery he's going to do at the same time.
Finally, I'll reconstruct the base of the nose by grafting skin from the side of her face.
So it looks like he's putting what we call spreader grafts into the nose, and these are two pieces of cartilage that are put literally on either side in front of the nostrils to help widen basically the nasal tip. That can also improve the breathing. And then he's doing a nasolabial flap where he's taking skin basically from this part of the face and rotating it over. I'm assuming he's doing that because she lacks enough tissue in that part of the nose to create the shape that he's looking for. This type of flap is usually used in people who've had cancer surgery. They're missing, let's say, the nasal ala or the nostril, and you can use that to help reconstruct that nostril.
So let's take the drill now and let's start contouring and really shrink it down, especially since it's so high over the top part of the nose.
If you go to an orthopedic surgery operating room, you hear drills like this all the time. In plastic surgery, it is pretty rare. We do use drills like this when we do facial reconstruction. If somebody's, let's say, been in a car accident and we put titanium plates to help reconstruct the bones. Honestly, I don't think I remember ever using a drill when I'm doing a cosmetic rhinoplasty, but there are situations like in this where that can definitely be helpful.
Yep, I got some good bleeding there. Now, I need the Doppler as quick as you can give me. Okay, so take a look at that flap.
So why is he calling for a Doppler? And what is a Doppler? Well, a Doppler basically is a small portable ultrasound device where you can listen for good blood supply. You can listen for actually the arteries in different parts of the tissues. So if you put a Doppler over an artery, a vessel that's, let's say, supplying that flap, that tissue that he's moving over, you should be able to hear a swishing sound. Whoosh, 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 when the artery has blood going through it. And this is a way to know that your tissue is going to survive. If you use a Doppler on a flap like this that you're moving over and you don't hear anything there, then you start wondering, is there enough blood supply to actually survive?
I had surgery yesterday.
And I
I'm
am
a little anxious right now. It feels like there's something on my face that I want to just pull off.
Okay, I know you're thinking this, and I'm only saying this because I know you're thinking this, that looks like she has a maxi pad on her face.
All right, so let me take this off. Okay. That tip looks so good.
Oh, this nose is going to be great.
Pretty shocking, huh? Now, I've seen a lot of different flaps to reconstruct a nose throughout my 25 years or so as a plastic surgeon. There's the nasolabial flap that they used here. We do forehead flaps where you can actually take tissue from the forehead and move it down to reconstruct the tip of the nose or other parts of the nose. And there are even smaller flaps like the bilobe flap where you move tissue from one part of the nose to the other. So believe it or not, as scary as this looks, it looks pretty good because the blood supply looks great, and it's going to look much better when her second surgery is performed.
So I'm going to give you a mirror, okay?
All right?
Because you are going to have to see this to clean it. I'll put you look at it when you're ready.
Oh, Oh my God, it looks like my nose is giving birth.
It can be really shocking when patients undergo this type of reconstruction. Now, the good news is that it's not going to stay this way. The idea is that you move the tissue over there and you leave it for about 3 weeks. It takes about 3 weeks for new blood supply to kind of grow into that tissue. Then you can sever the connection from basically the new part of the nose to her cheek where it came from, get rid of all that, and you leave it there, and it usually then heals in place. So as scary as this looks, after her second operation, the separation of what we call the pedicle, the blood supply, then it's going to look much, much better. And then it's not uncommon to undergo future operations to kind of thin the rest of that tissue out to contour it even more.
This is the skin from right here. This blood supply is new. So when this blood supply is good enough that it does not need to be attached anymore, we cut it.
So this looks so scary initially, and because of that, a lot of patients who have these types of staged procedures done refuse to go out in public when they're looking like this. The funny thing is that usually after about a week or two of them staying inside and saying, I don't want anybody to see me, a lot of times my patients have at that point said, you know what, I really don't care. I'm gonna go out in public, I gotta go to the store, it doesn't matter to me if people stare at me. And inevitably, little kids do stare and they point, and you know what, that's okay. Some of them actually make it a teaching moment for them.
Before I had the reconstruction, my nose looked like I hit a wall. I was very insecure. I held myself back from everything. But now my nose looks normal. I have so much more self-confidence. So it really can change your whole outlook on life.
What a beautiful result by Dr. Nassif. But this is not the most challenging problem I've ever seen him take on. Take a peek at this video where a woman had filler injected into her eye, and I can't tell you how dramatic her change is going to be. You have to take a look at this one. And remember, eat real food, use clean skincare, and autojuvenate before you operate.